I always tell people when people say, what does a universal healthcare system involve? There's sort of three key characteristics, and they all have them. So everybody has health insurance, right? You live there, you're a legal resident, you have health insurance. There's some differences about how immigrants are treated in some countries from others, but certainly if you're a citizen and frequently if you're a legal resident, you get health insurance. Number two, the health insurance is comprehensive enough that it is designed and largely achieves the goal of making sure everybody can afford health insurance. So, insurance might have a copay element. You might be paying premiums, whatever, but is designed to make sure everybody. You don't have to decide, gee, should I take my my high blood pressure medication, or do I pay groceries? Oh gosh, I'm in the hospital now. I'm going to be in debt for a year or 2 years, whatever, go bankrupt. That's not to say these things never happen in these countries, but in general, it's much less frequent and is much less pronounced. The third part, and this kind of tends to get a little less attention in American politics, but in all of these countries, to make these, partly to make these systems sustainable, but also just for the sake of holding down the cost of healthcare, the government takes a very active role in controlling spending. And usually there's a combination of they'll set some kind of overall budget year to year, say this is how much we're going to spend as a country, which you can do when you have one system. You have your arms around the whole thing, and then typically they get in the more detailed level. They'll say, all right, one way or another, we'll tell that, this is what we're going to pay the doctors for these procedures. This is what we're going to pay for prescription drugs. This is what we're going to pay for our hospitals. So the Japanese system does all those things. And, I would say that the most obvious difference is, again, everybody has health insurance. You talk to people there, and it's just, you don't have the stories you have here of, we have so many, right? And even now after Obamacare, after Medicare and Medicaid, we still have so many people without health insurance, so many people with high out-of-pocket costs. And that's just not really a thing there in the way it is here.